So we are here at Spainhower Wellness Center, and I am here with Dr. Gary Spainhower, and today we're going to talk about plantar fasciitis. So before we get going, Dr. Gary Spainhower, can you tell us a little bit about you?
Yes, I'm a practicing chiropractor. I'm in my 39th year, and I'm a certified chiropractic sports specialist, which means I've had advanced training in using chiropractic and other techniques for extremities and other problems. So the same thing that works well for the professional athlete, which I've treated quite a few, works well for mom and pop and you and I. So we try to have the best in technology to help rehabilitation.
Awesome. Can you tell us exactly what plantar fasciitis is?
Yes, and for those of you watching that have had plantar fasciitis, I don't need to describe it for you. You get out of bed in the morning, and this is the most classic. I get out of the bed, and the first 5 to 10 steps, I can hardly walk. I have these deep bruising type pain on the bottom of my foot. It can be in the arch, anywhere along the arch. After 4, 5, 6, 8 steps, it starts to go away, and then it doesn't bother me so much in the early stages.
So does it normally hit one foot, both feet? How does that
It can
normally
be
go?
either way. There's several things that can cause plantar fasciitis. It can be an overuse. So if you're and if you never had it and you go out hiking in the rocks and the mountains and your shoes aren't very supportive, you could have one side.
Okay.
It's often in both.
Okay.
And again, painful getting up in the morning, and then oftentimes at the end of the day you go to bed and your feet are aching. And
Does it normally hit a certain age range?
could be any age. It could be in the
Okay.
teenage years. It could be all the way up to in your 70s or 80s. Probably most people I see are 25 to 50, but yeah, any age.
Okay. What causes it?
I'm going to show you a little demo. This is a model of a foot,
Okay.
and the arch of the foot is designed for appropriate gait, and between the arch there's
I'm gonna lift it up so everyone can see it.
muscles that connect, that move your toes and your feet and support you. And then there's a material called fascia between the muscles and that arch. And that fascia is like the silver skin that you've seen on a roast, that real strong tissue. And that fascia is part of what supports that. The musculature does, and then the fascia. So it's a span over the foot. And that gets bunched up a bit, or even little micro tears between the fascia and the muscles, and then that becomes highly inflamed. So if you think of elastic, and if you pull it hard enough, you might get a few fibers that spring or tear. That's what happens here. Some number of fibers are broke loose from the other, the fibers, and then that is the beginning of the inflammation. And if your body can recover, you went hiking and you get really sore, you're going to get better the second day, third day, fourth day, fifth day, and you're probably not going to need treatment. The people that I see, they may get better, they get worse, and then over time, by the time they see me, they can hardly get out of bed with that pain, or they know that it's not okay and they want to get it treated.
So does it normally start, somebody's had an injury and then it just builds, or is this overuse?
It's mostly overuse.
Overuse,
Rarely
okay.
do I see somebody that has what I call acute plantar fasciitis. Usually
Okay.
it's a developmental thing. It can be acute that, like I said, they go out walking in the mountains, they're not used to that, the support wasn't good, and that begins that inflammatory process. But usually, people that have had it recurring, they've got a problem with the arch, and we take a look at healing up that damaged, inflamed fascia, but we also may consider orthotics that are designed to support the foot. It depends on chronic recurring, you almost have to do it. And so the supports we use are actually flexible orthotics that are designed from a model of your feet that support the 3 arches. Okay, there's arch across, everybody knows about the long arch. There's also a transverse arch, and then so those arches are necessary to support the foot. And since these are custom orthotics, that's why they're different. The second thing about these, they're flexible orthotics. So our experience is that the muscle strength and integrity, contracting the muscles, are a key part of a healthy foot. So if you're just sitting on a molded piece of plastic, you're not using the muscles. And so you're not going to have as healthy a foot. And there's a bunch of reason to be concerned about that.
So I could see a bunch of people saying, I'm just going to run out and go get something underneath my foot at at Famous Footwear or whatever. So talk to me about when you say these are a little bit more custom as opposed to somebody running out to CVS pharmacy and grabbing some kind of foot support.
If you have no feet pain, your feet are fine, and you want to put an arch in, go ahead and get whatever feels good, and make sure over time your feet are supported and you do well. Don't spend a lot of money. If you've got recurring plantar fasciitis, had them more than once, or if you have it and you heal up even with me, I don't necessarily go right to the orthotics because it's quite an investment. But if you've had it numerous times and your arches are not supported, then you want to get a custom orthotic. And you want to get the flexible orthotics.
Okay. So what do you do here that is not going to happen in the family doctor's office? How is that different?
Yeah, the traditional approach is you have plantar fasciitis. Most physicians are good at diagnosing that. And they'll send you home with anti-inflammatories. A lot of times they'll tell you to rest for 4 weeks. You go back in 4 weeks, you go, I'm a little better. And they go, okay, great, do it another 4 weeks. If you're bad enough, they'll send you to podiatrist, and then they'll tend to put you in a boot. Now, the problem with the boot, most of the time it's unnecessary. We want to treat the inflamed fascia. But the boots create secondary problems, both in the ankle joint, the knee, the low back. So it's not uncommon. I'll have somebody come in and develop a whole syndrome of problems secondary to that altered gait in the boot. So if you don't have to do that, you're better off. Rarely do we have to do the boot.
Yeah, I could see a boot, if it's going to make one leg higher or lower, you're going to have hip issues down the road.
If it's one-sided, absolutely. Or if it's both sides, those boots are not designed, they immobilize a foot, so your gait is altered significantly.
Yeah. So if somebody comes in here and they've got this, and you are going to get them into one of these dealios, what else do you do? Is there other modalities that you will do?
Yeah, we have laser therapy that does absolutely wonderful on plantar fasciitis. So the laser actually promotes tissue repair. It speeds up the healing process of the damaged, inflamed muscle and fascia. We also do adjustments or manipulation of the feet because healthy foot joints, healthy motion make a big difference. We'll do have patients do some homework, some myofascial release, often over the fascia, and then we have some supplements that can actually support repair. And so it depends on how bad it is. Sometimes it's just a few visits, there's substantial improvement, and if they do the homework and so on, if it's been, then they can get well in not a lot of time. If it's a year, 3 months, 6 months, it might. Generally in 2 to 4 weeks, patients know a substantial improvement. They know they're on the right track, and a lot of them are out of pain in 4 weeks. So it depends on the degree.
Awesome. So they come in, they get your little magic, and off they go. Do you see people coming back later saying, it went away for a while, but now it's back?
Yeah, those who, they get better in a visit or two and decide, I'm good, and they leave, and some of them will come back. Some won't. It depends on if, like I said, it's that time in the mountains walking around, a one-time thing, or if they've had recurring problems. The ones that have recurring problems, we generally say, let's fix this for good.
Okay, so we've got the orthotics, we've got laser, we've got some manipulation, chiropractic manipulation with the joints, and anything else
some
to add to
home
that?
therapy that we have you do depending on your particular plantar fascia problem, and then we have some supplements that help promote tissue repair.
Absolutely awesome. That's great. The general public, how many people, is this real common?
I can't give you any percentages, but I probably see a plantar fasciitis patient 2 a month. So fairly common. I mean, is it 10% or 1? I'd say, 0.5% of the population maybe. Yeah.
Okay, awesome. Well, if you guys have any other questions, in the comments below, ask those questions. Dr. Gary Spainhower will come in and give some answers and the information on how to get a hold of him if you'd like to come in. He's in Rancho Cordova. We will have that on there for you, but I hope this is helpful for all of you guys. Go ahead and be well and take care of your body. Thank you.
You deserve to feel good.
Absolutely.